and welcome back to this medical podcast series at MedSynapse. I am your host, Dr. Harshita, and today we are honored to have with us Dr. Sudhanshu Mishra. Doctor is an associate consultant in internal medicine at RV Hospital, Gurugram. And today our focus will be on a very interesting topic, role of medical internet of things in the management of chronic diseases. Without any further delay, let's start the session. So, Doctor, how do medical Internet of Things transform the landscape of chronic disease management? And what specific chronic conditions have shown remarkable improvements through their use?
I will just go around a bit and then come to the specific questions. So, primarily the disease landscape in India was sort of let us say, it was primarily a communicable sort of a predominance pattern in India. Tropical diseases like dengue, malaria, chikungunya, as well as in chronic diseases before 2000 or so, let's 1990, it was limited to managing failures like heart failures, even emphysema, COPD, lung failures, and even sort of kidney failures. Now, primarily with the advent of new measuring systems in chronic disease management, we are now able to diagnose diseases at a very early level, can plan accordingly, and first of all, the problem decision clinicians or surgeon faced earlier was precision. And basically, even nowadays abroad or in India, the treatment has moved from sort of a patient focused system uh, at sort of a molecular level now. It was earlier about diagnosing course signs, symptoms, and all these things. Now it has moved to a more precision levels where we have more monitoring systems. And Internet of Things is sort of a, let's say, a sort of a communication device that communicates remotely, primarily via remote server. They have specific ontology, RDP patterns, and from that we have device medical IoT. So IoT can be used in industrial sectors also. They are basically also used in agriculture also, but primarily medical IoTs are sort of a specific type of devices which are helpful in not only chronic diseases as well as in now viral vectors also. Now, basically, MIOTs are primarily used in diabetes, hypertension, and this heart diseases. And also nowadays, even in some let's say brain disorders like schizophrenia, they are used in rehabilitation. So these are three or four chronic diseases where medical IoTs are primarily used, and they have shown remarkable things like CGMs. Let's say in market there is Abbott Freestyle Libre Pro, which can give a 10 to 14 days easy reading of every 15 minutes of sugar level, and that can be easily implanted. To sort of a more advanced version like Eversense XL of CGM, which can give a monitoring of 90 days, and that's a required specific type of training to place that. So these are the CGMs which are used. We have now Apple watches as well as Xiaomi health bands, but Apple watches we have on a typical, and you have your pulse and all these things. Apart from that, they have specific sensors also to detect some brain pathologies also. So these type of MITs are helping in chronic disease management, and particularly, for example, in diabetes, we have glycemic variability, compliance factors, which are more and more sort of becoming increasingly important now because of sort of more choices to the patients, and doctor shopping intent. For example, you can consult me, you can consult a physician nearby, you can consult AIMS physician 50 kilometers above, or consult a Cleveland Clinic one. So sort of remotely, but as a sort of a teledoc, you can say that. So this doctor shopping basically damages the compliance of the treatment cycle. So that type of things are addressed by medical IoTs.
Yeah, thank you, Doctor, for your insights into the transformative impact of medical IoTs. And now, Doctor, can you provide examples of MIoTs currently used in the chronic disease management and what innovative features do they offer?
Yeah, as I stated earlier, uh, the best MIOT I will give is CGM. That is sort of a glucometer, which is remotely diagnosing sugar levels. Now, basically, MIOTs have been various type of. There has been even sort of a sensors in the eye which can detect the vitreous sugar levels that have, but their accuracy are more than error is more than 20%, so they has been discontinued. And nowadays CGMs are widespread in the market. Like, let me give a Abbott Freestyle Libre Pro. You go to a very good diabetologist, he will recommend that, he or she will recommend that. It's a easy placement on your elbow and easy detection for 10 to 14 days, and that's a very good measure of glycemic variability. Particularly helps in hypoglycemic patients or sort of a patients who are not able to control their sugars, OHA, like oral hypoglycemic drugs. So these are the main examples I give of CGMs. Apart from that, there are various things. There are ambulatory BP monitors also. There are ambulatory ECG devices also, but they're primarily limited to sort of a setting where they have a, let's say, just like an NHS model, like of insurance models like in Scandinavian countries or sort of US or UK or even in Malaysia or Thailand, not here. So I will give CGMs the primary example in this medical IoTs.
So, moving ahead, in what ways do MIOTs empower patients to actively participate in their chronic disease management? And how can these technologies improve treatment adherence and self monitoring?
There has been recent advances in medicine. Two terms I will definitely highlight. One is integrative medicine, which integrates all the complementary and alternative forms of medicine into allopathic ones, and plus a holistic system of medicine, which examples like yoga, pilates, and all these things. So in chronic diseases, these things do matter. Many physicians and surgeons ignoring it, but these things do matter. And basically, in MITs, what they do is it helps patients take control of their chronic disease condition, because there is a psychology of sort of a depression. In chronic diseases, there is a very good phenomenon of depression because of treatment failures, doctor shopping, might be too costly drugs, might be some other issues like marital life issues, like let's say COPD or chronic smoker COPD, or let's say diabetes with a ED. So there are definitely some things which you can take control with the MIOTs, because they give a sort of real time measuring system of your health. So these really help in patients also having a confidence that their disease conditions are getting treated as per their liking. Because nowadays, with more in litigations and SUI, malnegligence and all this field filed world over, sort of this becomes more and even a physician, if you can say from my point of view, I can understand a patient's concern, and patient can understand my concern by a real time monitoring system, which was not available earlier. Earlier, which you used to diagnose from core signs and various, let's say, skyograms or ultrasounds or CTs or MRIs, that's fine. But sometimes what happens is even I cannot go to CT every 3 days. MRI I cannot do every 1 day, or I cannot just go to a physician every 15 minutes and ask for my health. So these type of MITs help patient basically take the chronic disease management into their hands as well, which helps a patient doctor relationship, which is very vital in treatment choice and compliance issues.
Yes, doctor. And yes, these are shifting patients' role from passive recipients to active participants in their health journey. So, doctor, can you discuss the potential of MIOTs to predict disease exacerbation or complications in patients with chronic conditions, and how early interventions can lead to better outcomes?
They have alarm systems in some MITs which can even detect a hypoglycemia also, like Eversense has that. So, for example, if your blood sugar goes below, let's say 40, 45, 60, there are specific alarm systems for that which are remotely controlled by servers. So, these help in patients' emergencies. Plus, even in latest Apple Watch, they have sort of gyroscopic sensors which can detect your heart rate, and particularly in PSVTs or some sort of TIAs, it can help. So these type of things can help in medical emergencies. So that is why nowadays, but I have earlier stressed, in India it is primarily telehealth is primarily limited to either telesurgery or remote surgery, Da Vinci robots for urological surgeries, or just a sort of a telehealth in rural communities by the various government agencies. These, and nowadays video medicine by various providers. But these type of MITs and kiosks are coming now, and many patients are now learning to adapt in last 2 or 3 years. So I think it in India it will take a couple of years or might be a decade to completely adapt to the model. But in say UK they have a sort of a emulator BPs also for because they have NHS covers and all this insurance covers. Our OOP, which we can say OOP is more than 60 to 70%. So it will take around 60 to 70. Even insurance companies are not including MITs in their sort of insurance plans. It will take 2 to 5 years to 10 years to adopt that. But definitely they have good alarm systems. When a blood sugar goes below a certain threshold, it can alarm you. So these type of gadgets help in remote monitoring of diseases, particularly to a physician or to a patient. So let's say a geriatric patient, a 60 to 65-year-old, male or female. So it helps because they have no colleagues, might not be a social support system there. So it helps them. So these type of MIT's interventions are really helping physician or a surgeon take control.
So moving ahead, how do MIOTs enhance communication and data sharing between patients and healthcare providers? And what role does telemedicine play in leveraging these technologies for remote monitoring?
Okay, so let's say example. Uh, I will just say 1990s or 70s. In 1990s, for a sort of let's say sugar, you just go to your technicians or to a physician or to a nurse, which can diagnose by pricking sensations. You have to measure your blood pressures, and after measuring, they give you a definite reading, which might be variable, human variable. Let's say I diagnose BP at 160 by 80, someone diagnose 140 by 90, and a nurse diagnose 180 by 90. All three might be correct, all three might be wrong. But nowadays with MITs we have a device. Even in sugar monitoring, you might have sort of Google around, or you will also do some market search. We have mobiles as a device where we have specific data sets, which specific data sets are very easy to decipher and also to interfere. Easy data set of, let's say, freestyle libre pro can directly give me a glycemic variability which I am very comfortable in, so that I can titrate the sort of let's say if insulin analogs long acting or a short acting or a sort of ultra short acting or sort of a OHA, triple OHA or whatever, if it is on DPPs or depends on the specific patient condition. So I can titrate that, as well as patient can also can see his rapid improvement in blood sugars. So these type of let's say for example blood pressure 180 by 90, 5 minutes 170 by 90, and 176 by 90. So you are also very comfortable that your blood pressure can be monitored by you as well, even by a layman also. Even in Eversense, it's just Eversense is more sort of tedious to implant. That is why it has a very good alarm system. Otherwise, it is a very good 90-day sugar reading you can take. So, anyways, these MITs with the help of mobile phones, or nowadays we have health bands, you have Apple watches, you have your smart watches, you have specific data sets which you can infer directly. A layman can infer directly and interfere directly, going to physician. And even I can sort of triangulate data sets into a more sort of better MIOT or sort of a remote monitoring system in some time. So it helps. That is why MITs are changing the landscape of chronic disease management.
Now, Doctor, coming to the safety and regulatory considerations, can you share your insights into these surroundings, the use of MIOTs in chronic disease management, and particularly concerning medical device approval and patient safety?
uh, Regulatory, one of the things which MITs, the major fear is open source system. uh, let's say it will in second lecture, which we might take later on, ingestion sensors, I might explain it more. Open source IoT system is more prone to a DDoS attack. A DDoS attack can easily, I can sort of remotely hack your sort of physical devices. Let's say a T1 DM, which is a sort of a insulin device or sort of a remote monitoring systems. So this DDoS attack and open source technologies are still a few sort of a years away. So these regulatory things are sort of hindering the MIT development. Regarding device in India, 90 to 99% it is sort of a re-engineered one from patented devices of Scandinavian countries and might be US. And even research papers, if you can just go to a PubMed or a Lancet, there are hardly in India hardly 8 to 10 research papers in telehealth and MIOTs. Basically, in states they have very good telehealth societies. In Scandinavia, they have very good sort of infrastructure there. So sort of in India, it is back engineered. So regulatory compliance error of 10 to 15%, which is legal, systolic to diastolic waveform. A waveform error is legal, so that regulatory things also there. Earlier they used to this teardrops sugar monitoring systems, which error rate was 20%. So in devices, the error rate, the openness, it is still some time, maybe around 3 to 5 years. We can say that these might be open source because there is open DDS attack. That is a very good possibility there. So that regulatory aspect need to be kept in mind.
Yes, doctor. And what challenges do you anticipate in integrating MIOTs into routine clinical practice? And how can a healthcare system overcome these barriers?
Yeah. So two things: Ayushman Bharat and OOPs. Ayushman Bharat is a sort of very good scheme launched by central ministry. But thing is, in India there are various sort of, let's say, Bhamasha or various state government schemes that are sort of demerging or remerging on various sort of let's say various stratas are made. So it's sort of a confusion and out of pocket system. For example, in UK or US, you have very good insurance systems. So I can directly provide you everything directly and got it paid from a sort of a TPA or sort of a payment provider. In India, many people cannot afford a lifestyle abroad. Ever since is very difficult to procure and very sort of a costly device. So in India, once insurance company starts more penetration, it is already penetrated 50 to 60% agreed, but sort of in chronic disease management and particularly in some conditions they are still sort of limited to sort of claim sizes, and they don't have a very good NHS like network in India. Plus even in government NHS like Ayushman Bharat, they are still creating that sort of what to say, sort of the database is still not that coherent and still what to say, it's still not that widespread that I can directly pick a data from, let's say I'm in Gurgaon, you are in Bombay, and I can directly pick data from Calcutta patient directly. I might be consulting in Teladoc or the Doctor Insta or CareFit. I can directly cross integrate them. That is not possible now. So there are various issues, but hopefully with 10 to 15 years, and they have very good API sandbox also launched by government around 3 to 4 years back, or might be 5 years back. Might be there is a Kilkari app and Goonj app and all these things. There are various apps you can develop on that, but once there is a cross integration of these data sets, it's very difficult to sort of generalize MIOT adoption. And plus, obviously, OOP needs to go down. It is still, I think, it's still in late 60s, I think, might be in 70s. So, so thing is, once you have very good insurance systems, sort of a cross integration of data sets, that MIT spread can be widespread. Plus, obviously, open source will lower down the cost. But I already said open source will more prone to DDoS attacks, and in that case, it's very difficult to then protect the privacy of patients, because patient data privacy is also a very good, like say HIPAA. HIPAA has a very good stringent guidelines. So that is one of the things which we need to keep in mind, because the in India this data compliance systems are not up to the mark. As I already said, in India it is a quite a boring landscape limited to video consultations and remote surgeries or regarding urology. All these new MITs will take a couple of years to 5 years and might be to 5 to 7 years to get adopted. Even to a normal physician, you can ask, he will just say a sort of a video call or telecall. It is very sort of a it, ancient technology now. With the ISRO and IGNU, they already did that, and very rural Delhi already done that. So these modern MITs will take some time to get adopted.
Yes, doctor. And can you discuss the potential cost implications of adopting MIOTs and how these technologies might impact healthcare spending and resource allocation?
So basically, let's say Eversense might be 18,000 to 20,000 a device, which you have to use. Say you are a chronic diabetic, might be on long-acting insulins with a short-acting one, or might be on DPPs or SGLT2. Depends on the patient. If you might be a obese type patient, so might be having a CKD or CLD, might be having a ED also, with another ARBs and all these things going on. So basically, thing is, once you can afford it, that's thing, because as I already said, the cost of drugs also got added up in this. For example, a very good drug like Lyzembi costs 70 to 90 rupees per tablet. So I am spending around 5,000 to 7,000 rupees on sort of a diabetic medication I am taking, plus 92,000 rupees for another lipids and all these blood pressure medications and all these things I'm taking, supplements and all these things, which are sort of a what to say, a treatment which is devised to all patients, tailored specific to their needs, plus an IoT, plus an MIOTs. So let's say Eversense is 10,000 rupees. It is much more costly than that, but let's say 10,000 plus 9,000 plus visits to a consultant. So it comes around to 20 to 25,000. Very good MIT. Even if you are a subscription model patient of 6 months to 12 years in a specific sort of a PCMHs or cardiometabolic clinics, or sort of a, even in some other surgical sort of subscription plans which they have, the cost is still around 10,000 to 15,000, which is still beyond sort of out of reach for a common man, because I have to take many cost in mind. And plus, if I have sort of a uh, old parents and not have insurance cover, the cost of treatment goes up. So it will, as I already said, two things: Ayushman Bharat and OPs. Once Ayushman Bharat can sort of get a generalized data system, it has a sort of a more sort of a generalized feature, sort of secular system, where I can just get a data set from Andhra Pradesh or might be from a Pahalgam directly. In that case, with a good sandbox, they have good sandbox API also, and developing very good apps also, and plus also OPs, out of pocket payments. Once it goes down, that option will increase, but as they already know, it will take some time. It will take some time, ma'am, because these MITs are mostly manufactured outside India and mostly imported.
Yes, doctor. And coming to the last question, how do MIOTs complement or potentially replace traditional surgical approaches in managing chronic disease, and what are the benefits and limitations?
Basically, they primarily use like Da Vinci robotic system, which is fMRI is a very good Da Vinci system, Da robot systems in Gurgaon, one of the best coordinate hospitals. So they have a sort of a good urological surgical apparatus. They also do spine surgeries. So the precision, the level of precision a surgeon wants, sort of more bloodless field, and sort of a, let's say, more errorless type of surgeries, and sort of a more stress-free type of surgery which a surgeon wants, is possible. Nowadays, it is more moving into other realms also, but it is still in research. Even in MITs or various journals, you can also find remote surgery papers, but they're primarily limited to urological surgeries and spine surgeries. So they are using that only. Might be in next 5 years or decade, there are very good applications in new sort of fields regarding to surgery, but at the moment, their level of evidence is not that great to comment upon.
Yes, thank you, doctor, for the comprehensive explanation. And now we have arrived towards the end of this episode. So, thank you, doctor, for your time and for sharing your expertise on this topic. It was a great pleasure to have you here with us. And thank you, audience, for tuning in. We hope you found this session informative and insightful. Remember to stay connected with MedSynapse for the latest advancements and expert knowledge. See you and bye bye.